Columbia Morning on the new 98.9 FM and 1400 AM KFRU. I'm joined in the studio by one of the doctors from the University of Missouri Healthcare, Denicia, Dwarica. I was close with that.
Yeah, no, you're really good.
It's nice to welcome you. Now, you are at the university, and you are, I think, an OBGYN.
Mm-hmm.
So you deal specifically with women at a certain age or all ages after they've gotten to the point where they have had babies?
Mm-hmm. So primarily I deal with women around the age just before and after menopause, because I'm a specialist in female pelvic medicine and reconstructive surgery. So we tend to see women later on after they've had all their babies and after they've gone through all the child raising, and then they start to take time for themselves. That's when we start seeing them.
All right. So this question, I think, is one that we need to get out. I bet the age varies for when this sets in. Is that a true or false statement?
Well, there's a median age for menopause. It, according to the American College of Obstetrics and Gynecology, it's around 51 years old, but that's a median. So there are women who experience it a little bit earlier and a little bit later. But around the time 50, 51, 52 is when you would experience it.
Let's talk about it first. And I want to talk about it from a man's perspective,
Yes.
what maybe a male could understand about this. But let's first of all zero in on the situations that generally you see as the physician with a woman right around menopause age or postmenopausal. What are the biggest things that they're dealing with?
So when we look at the menopausal transition, we look at primarily, we define it as a cessation of menses for at least a year. But prior to that, women may have irregular menses. They would have hot flushes. They may have mood liability. And some of the things that I specialize in, they may see increased issues with urinary incontinence, pelvic floor discomfort, pelvic floor dysfunction, and even pelvic organ prolapse.
Was one of the things you said, what did you say, emotional liability or something? That sounded pretty interesting to me. All right, so these things are going on. So they should feel like they're not unusual when these things are happening, correct?
Yes, so around 50 to 80% of women experience at least a hot flush symptom, or what we call a vasomotor symptom, around that time. So it's pretty common, and I don't think a woman should feel like she's the only one out there. Unfortunately, it's not the best feeling in the world, though.
See, I can't understand that. I'm getting some firsthand experiences with this. How long do they last? I don't mean an individual hot flash.
Yeah.
I mean, how many months or years do hot flashes occur?
Well, older studies show that it should last between 6 months and 2 years, but we have seen that some women could experience it for 10 years out. So hopefully, the person you're talking about is in the luckiest stage, 6 months to 2 years, but it could be 4 to 10 years.
What causes a hot flash?
So it's related to your hormones. So in women, we see a decrease in estrogen, we see a decrease in progesterone, and that somehow affects the way in which we thermoregulate. And it's just hard for us to, sometimes to adjust to sudden changes in temperature. So women would experience sudden heat in the face, in the upper body region. It should last a couple of minutes. It shouldn't last more than that. But it's really unpredictable. It's really uncomfortable. And that's when you usually see them pull out the fan or leave or turn the air up. But it's really hard to predict.
It would be unusual, I would think, for a woman to come to see you just because of hot flashes. I mean, they're not coming because of hot flashes, are they?
I think a woman should feel comfortable to see a doctor with any question.
I see.
But just like when you're ready to have babies and you have a positive pregnancy test, if you're excited to make your appointment, it's the same thing for the menopausal transition and anything that happens afterwards. We have experts in every field that could take care of any type of problem.
Do you find that women are hesitant to come then to a doctor for these? Maybe I think sometimes, I mean, I would say it's not that much different than a man. You just basically pass it off and say it's part of growing old.
Well, I think women are hesitant more so for some of the more, I would say, secretive things. So everyone talks about maybe menopause, maybe hot flushes.
Hot flashes, everybody. And we kind of joke about that. I mean, sometimes even women might joke about that. I understand that it's probably an annoyance to them, but they sort of
feel comfortable.
Laugh it off. Yeah, they feel comfortable talking about that.
Yeah, but some of the other issues like urinary incontinence, that's what I see a lot. Women are afraid to talk about it. Women think that's a normal part of aging. It's not a normal part of aging. And women think it can be fixed. Everyone says, well, my grandmother had that, so I expect to have that. But unfortunately, it's one of the number one reasons why women end up in a nursing home, because they don't address it early on when we could take care of it, and they just think we
Then
can't
it
fix
progresses to more of a problem then?
It's not that it's more of a problem. It's just that incontinence is one of the biggest issues why the elderly end up in nursing home. But it happens around just before menopause, a little bit later. It seems to get worse, and we could fix it early on.
How do you fix it?
It depends. We could do simple things like lifestyle modification, diet changes, or even pelvic floor physical therapy. And then we have some medicines that we have in our toolkit and some surgeries that we could perform.
What's the percentage of women that would deal with a situation of incontinence like you're talking about where it would need a physician's attention?
So 1 in 2 women of all women experience some sort of incontinence. And it varies by the type. Most women experience a mixed picture where they could leak with cough, laugh, or sneeze, or they could leak with urge. But most women won't need surgery, especially if we are able to address it early on.
Does it ever pass? I mean, is it something like the hot flashes? Eventually those are going to end?
So it's more like as you get older, you have a discomfort, arthritis, and you just take care of it. So you don't have the symptoms. So for the most part, it's maintaining that sort of lifestyle. So you prevent it. And sometimes surgery could eliminate it. But those are some of the things that we could fix.
I'm one of those persons that is very hesitant. I'm very shy about talking about certain things. So I would have a hard time going and talking about certain things, a perspective. So what I'm about to ask you is very hard for me to ask you.
Okay.
But when it comes to sexual relations, how do you deal with that? And is that a problem that occurs?
That's a great question.
Yeah, that's a hard question to ask.
So remember I mentioned that around the time of menopause, you see that typical estrogen and progesterone level go down. That affects the epithelial cells in the pelvic area. I'm avoiding certain words because we're on the radio.
I thank you for doing that. And you might even have to keep, I don't even understand some of the scientific terms.
But in that case, think about your skin. Just your hand. If it's dry, it's uncomfortable. If you were to pass this table and scratch it, you could get a little scrape. It's the same thing down below. You could have thinness and dryness and discomfort. So it makes your sexual function sometimes uncomfortable due to dryness. You could have pelvic pain symptoms, but those are all things that we could take care of. Especially if you look at the benefit of using estrogen in that area, topical estrogen, not the systemic. It's really helpful for ladies after menopause.
I think the message out there is that people who are dealing with any of these things, they can see a physician and not feel guilty or embarrassed about it.
Yes, come see us at the university.
Let me ask you this before I let you go. So you describe physiological issues in regard to postmenopausal women. How much of it is also preying upon the mental aspect of it? You're not a psychiatrist or psychologist, so you don't deal with that.
Yeah. Well,
but I would imagine sometimes you have to refer people. Or is that part of the physical change that occurs is also impacting the thought process?
So for the most part, we see that women, as we get older, we have increased risk of depression. But for the most part, we are able to deal with it. In our clinic, we usually don't have to refer to a specialist. But think about some of the changes that you experience. You're empty nesters. Your grandkids may be far away. Or your body changes and you don't understand. Or just a simple thing like you go to the grocery store and it's in the middle of winter and you're sweating like it's you're in Timbuktu. So it's a lot of changes that you go through and it's a big adjustment. So if you look at that in itself, you could see why as women get older, they could have a harder time and increased risk for depression, anxiety, and those issues. And then some of the other changes that take place, especially when they don't know that they could seek help and they think it's a normal part of aging. No, you don't have to go through that. There are ways in which we can help you and for you to enjoy your post-menopausal or menopausal transition, enjoy all your hard work in the future.
It's been a great segment. I appreciate you being here.
Thanks for having me.
And again, contact, I guess, MU Health with these kinds of issues. And they can, is there like a obstetrics and gynecology department? Or?
Yes. You could come and see us at the Missouri Center for Female Continence and Advanced Pelvic Surgery. It's 573-817-3165.
I see that right here. Thank you. Dr. Denicia Dwarica.
Yes.
Thank you so much for being here today. It is Columbia Morning at KFRU.